I'm going to talk on the theme of, does assisted suicide assist suicide? By that I mean, does the legalization of assisted suicide encourage people more generally to take their lives? And as a psychiatrist, that's obviously a pressing concern. And it's one that the College of Psychiatrists in Ireland are very exercised by, among others. I have to say, the College of Psychiatrists of Ireland, of which I'm a member, has taken a very strong line in opposing the proposed assisted suicide bill. I want to just talk briefly about some of the terminology that's used in this, because it's a bit confusing and different countries use different terms, and some organizations use different terms also. In Canada, they talk about medical aid in dying. Then assisted suicide is the patient taking the medication themselves. Euthanasia is the doctor assisting them in dying, and perhaps, giving them the injection or giving them the medication to take. Unassisted suicide refers to death without the involvement of any medical practitioner. It's what we commonly know to be suicide, where somebody takes their own lives themselves in a variety of ways. And finally, some proponents are suggesting that the word suicide should not be used at all, and that medical aid in dying or voluntary assistance in dying are the terms that should be used, and there's a whole debate around that. The World Federation of the Right to Die Society has opted for voluntary assisted suicide dying. MAID is clearly an attempt, but by taking the word suicide out of the name, they're clearly trying to sanitize what all of this is about, and that's what MAID is clearly about. But in Ireland, I think the word suicide has remained in the proposed legislation. Now, the arguments in favour of assisted suicide, and you probably know all of these yourselves, you're aware of them. Autonomy is the big one. Autonomy is the go-to framework that infests all thinking on right to life issues. At the beginning of life, it's to do with the autonomy of the woman. At the end of life, it's the autonomy of the person who is considering ending their life. So autonomy is sort of the favoured concept. Not the good of society or the best interests of society or the common good, or not first do no harm. It's autonomy. The second argument that's put forward, and the palliative care physicians will be very well aware of this, is that that it's to do with the relief of suffering, and that unbearable suffering should be ended by taking one's life. The third one, which is actually a very chilling one, is that assisted suicide is a safer medical practice for those who would otherwise die by suicide anyway. So if you get a lethal injection or take a lethal dose of medication, you will die, whereas if you attempt to hang yourself, you may not die. And I find that idea absolutely preposterous, but that is one of the grounds that's put forward. And a fourth one, which I'm going to explore in a little more detail in a moment, is the argument that it may actually reduce unassisted suicide, so that if you introduce assisted suicide, it will overall reduce assisted suicide. And that was posited by a man called Posner in 1995. And Posner was an economist. He had no experience of suicide or no knowledge much of it, But economists are very good at modeling things statistically and predicting things, when there's going to be a recession or otherwise. And so he suggested that assisted suicide would substitute for unassisted suicide. So a lot of people who would be wanting to die by suicide themselves, if they had unassisted suicide, would opt for that. So that in itself would reduce the head count, as it were, for unassisted suicide. He also said that some may defer taking their lives, knowing that at a time of their choosing, they could opt for assisted suicide or assisted dying. He then went on to say, not only that, but some of them may actually die from other causes before they would get to the stage of opting for assisted suicide. And so that would reduce the mortality from suicide and unassisted suicide. But the question is all of that correct? The first thing to say about Posner's hypothesis about assisted suicide reducing the rate of unassisted suicide and the overall rate of suicide is that it doesn't consider any negative impact of unassisted suicide on society and how people consider the value of life when assisted suicide is available. It also ignores what's known as suicide contagion, and I'm going to speak about that in a moment. And we all know about the phenomenon of copycat suicide, that particularly if a celebrity dies by suicide, people who identify with that celebrity's problems or identify with them because of their age or their interests or what they know about them are at higher risk of harming themselves. And people do copy suicide, and it can sometimes happen in clusters as well. If somebody in a school dies by suicide, that others will do the same, and that's a big worry for schools. Posner's theory also ignores the slippery slope. Now, I know that the slippery slope concept is a very complex one, and I'm not going to deal with it here because it's an extremely difficult area. I've been trying to read up on it so as that I could say something intelligible about it to you today, but I couldn't understand a word of what it was about. You would need to be a philosopher. I'm sure there may be one or two philosophers here in the audience who know all about the different approaches to the slippery slope. But one is the only one I could understand is the increasing rate of suicide and assisted suicide in countries where it is legalized, and I'll come to that. And it also ignores, Posner's theory doesn't consider things like depression in prompting untreated depressive illness and prompting requests for suicide, doesn't consider the ethics or morality involved, and it doesn't consider the impact that it would have on patients' trust in doctors. So there are a number of rejoinders to Posner's hypothesis. But two studies in recent years have specifically examined that question. Is Posner correct that if you introduce assisted suicide, you will reduce the overall rate of suicide, and you may reduce unassisted suicide as well? And the first one of those was David Albert Jones from the Anscombe Institute in London, and David Patton, who himself is an economist. And the second one is my colleague from the Mater Hospital who took my position when I left, Professor Anne Doherty. And both of those were published in the Southern Medical Journal and the British Journal of Psychiatry Open Access. So Jones and Patton examined changes in unassisted suicide in the United States in jurisdictions that allowed for physician-assisted suicide. And they compared data from 1990 to 1913. Remember, Oregon was one of the first countries in the world to introduce assisted suicide in 1995. So they took the data for assisted suicide and for actual suicide itself before and after the introduction in Oregon, and then in the other states that have introduced it as well. And there was an increase in all suicides by 6.3%, and there was no decrease in unassisted suicide. So, and the increase in suicide was particularly higher in those over the age of 65. So Posner's theory was not upheld. And the second study to examine Posner's theory, and there are only two, even though Posner is kind of a hero for the assisted suicide groups and the so-called death with dignity groups. They weren't tested until Jones did his study in 2015, and now Doherty, working with Jones, examined it again, examined the relationship between the rates of non-assisted suicide and of euthanasia-assisted suicide. EAS is euthanasia/assisted suicide, and compared one with the other in studies, individual studies that had done that, and that's what's called a systematic review. And she compared the rates of non-assisted suicide before and after the introduction of suicide in a number of states in the US and a number of countries in Europe. And a systematic review is considered the highest level of evidence you can get when you're studying an issue in medicine. And it's a study that examines all the individual studies on a particular topic. There are preset criteria for the quality of the study. So not every study comparing assisted suicide and unassisted suicide rates would necessarily be included if there were huge biases in the data, if there were major weaknesses in the study. So the criteria are preset for quality. And then if the measurements, the outcome measures are broadly similar, they're combined together and analysed as a whole, and that's called a meta-analysis. So this systematic review, it's accessible online because it's an open access journal, the British Journal of Psychiatry, open access. And they found that 6 studies met the criteria, and they covered databases up to December 2021, before and after unassisted suicide was introduced, and compared the rates. And they found that in particular in Switzerland and Oregon, that the unassisted suicide rates increased, particularly in elderly women. And they found that there was no reduction in the overall suicide rate when you combine unassisted and assisted suicide, but there was an increase in unassisted suicide in Switzerland and Oregon in older women. And that's very interesting because Switzerland and Oregon are the countries that were the first to introduce assisted suicide. Oregon, as I've said, in 1995, and Switzerland, I think, in or around 1998 or 2000. So they've both had assisted suicide for a long time. And so they were the only 2 countries as yet showing an increase. And I think that suggests that the change, the impact on society does happen. It's slow, it doesn't happen in the first year or 2, but it seems to gather pace over time. And an increase of 6% in the unassisted suicide rate in any group would be a very worrying statistics for psychiatrists. I mean, if we saw our unassisted suicide rate increasing in this country by 6%, we would be very worried indeed. So they're the 2 studies that specifically looked at it, and they found that there was no decrease in suicide. There was an increase in unassisted suicide. Now, the next question then that Posner ignored is contagion. Will the availability of assisted suicide lead to an increase in people taking their own lives, as the Doherty study suggests. And we know from, the literature on assisted suicide, the literature on suicide in general is full of studies looking at the contagion effects and what's called the Werther phenomenon, or copycat suicides. They're all studying the same thing. Do people imitate what they see in others? And for example, the celebrity suicides of Robin Williams in 2014 were followed by an increase in suicide rates in the US in men of that age. When Kate Spade and others, there was a transient increase in suicidal thoughts and behaviours in younger people, in people sort of in the late 20s, early 30s. In local schools, there have been imitation effects, and there are any number of studies, and I've just mentioned a few of them here that you can actually Google online. And these are just a few from the last 2 years, but these studies have been going on for many years. So there is a definite contagion effect in unassisted suicide. And that being the case, I think there is a strong inference that if unassisted suicide is made available, that in turn will generate, because it's going to be talked about, that there is going to be a contagion effect. And particularly, you know, if celebrities opt for assisted suicide, for example, can you imagine the effect if, God forbid, Elton John, who has been talking about his own mortality, if he opted for assisted suicide, the impact that would have on people who follow Elton John. It would really be very difficult, which would be a juggernaut, in my opinion. Now, the slippery slope is a theory that an event will lead to a chain of other events resulting in an undesirable end, often referred to as the law of unintended consequences or the domino effect. And some people, when you talk about the slippery slope to people who are in favour of assisted suicide, they will of course shout fear-mongering or fake news, the latest fear-mongering, fake news. But the question is there a slippery slope? And I think there is, because if you look at the suicide, the number of assisted suicide rates and the percentage of all deaths in various countries where assisted suicide has been legalized, take Switzerland, between 2003 to 2014, there was an increase in the percentage of suicides attributed to assisted suicide from 0.32 to 13%. That's a huge increase just in the course of 11 years. In the Netherlands, there's an increase in over 17 years, and I couldn't find the proportion of deaths, from 1,800 approximately to 6,300 in the course of 17 years, dying by assisted suicide. In Belgium, the number of deaths has increased from 235 in 2002 to over 12,000 in 2018. That's an enormous increase in raw numbers. To get back to percentages, in Oregon, and Oregon is particularly important because Oregon is the country that people say has held the assisted suicide law in place. There has been no liberalization of it, and it's what we should be aiming to achieve. I was debating this one day with Dr. Brian O'Shea, and he was holding Oregon as the model that the Irish government is trying to aim for. And in Oregon, even there, they had, when in 1998, 3 years after it was introduced, they had it was 0.05% of deaths, and in 2019 it was 0.5%. So that was a tenfold increase in suicide, in assisted suicide in that time. The other thing about Oregon that people often don't talk about is that there actually has been some liberalisation. It hasn't been static. And one of the liberalisations has been that initially they did not allow out-of-state assisted suicide. They did not take people from other states for the procedure, for the death. It was only people who were resident in Oregon were allowed to apply. That has changed. The other thing that has changed there is that they have now started euthanizing people with anorexia nervosa, with eating disorders. They have been doing that, of course, in Netherlands and Belgium for a few years. It's proposed that psychiatric disorders are going to be included in Canada, but they've put it on hold for now. So Canada, which probably has the most liberal law of all of them, apart from the Netherlands, in 2015 they had 1,012, and that has now gone to 5,613 in 2019, and in 2022 it's 4.1% of all deaths. So all of these countries, there are none of them showing a static assisted suicide rate. They're showing a steady increase, and these suicides are forming an increasing percentage of all the deaths that are happening in these countries. So I think that this increase is definitely indicative of a slippery slope. If it's not, then I'm a hen. Now, what will assisted suicide say about our suicide prevention policies in Ireland? And we have a very good system for suicide prevention. I'm pleased to say that our suicide rates have been decreasing for the last number of years, contrary to what the media would have you believe, but the official suicide rates have been reducing. And how can doctors, how can government officials with any integrity talk on the one hand about assisted suicide being a good thing, and on the other hand, other kinds of suicide being bad and something we want to prevent? It makes no sense. It's logically incoherent. And if we were to legislate for assisted suicide, what would happen our suicide prevention policies? How would we convey the word to a depressed patient thinking maybe of hanging themselves or jumping off a roof or whatever, taking an overdose, that what they were doing was bad, when on the other hand, other people suffering, for other people suffering, we'd be saying it's a good and compassionate thing to do. It's incoherent and it's not sustainable. And I think what you would have would be the social acceptance of suicide as an option for unbearable distress, not just when it occurs in terminal illness, but also in other settings, like in settings of mental illness. So, in conclusion, the evidence points to a very strong likelihood that assisted suicide legislation would also assist in bringing about an increase in unassisted suicide through widespread social acceptance, including suicide for mental illness and distress, as well as contagion over time. And the slope will be slow. It won't happen overnight, but as we've seen from Oregon and Switzerland and the countries that have been examined, they're the two now where after maybe 15, 20 years of legalization, their unassisted suicide rates are rising again. And there is absolutely no reason to believe that Ireland would be any different. If any of you are interested, I did an interview with Professor Anne Doherty on her study on the systematic review that she published in 2022 in BJ Psych Open, and it's on YouTube. And so if you Google her name or my name, or both of the names, and assisted suicide, you should be able to listen to it. It's a short interview, it's about 20 minutes long, and it will explain what the study did and what it finds and the implications of it. Thank you for listening.